Good afternoon, everyone. My name is Jeff Corbin, and I am a nurse practitioner student at East Tennessee State University here in Johnson City, Tennessee. I am here today to talk with you a little about neonatal abstinence syndrome, or NAS as it is better known. NAS is often described as a collection of both physical and behavioral signs and symptoms that are suffered by a newborn due to the in utero exposure to opioids or various other toxic agents. The occurrences of NAS have steadily risen over the last decade, due mainly to the overprescribing of opioids and benzos by providers and also by the nation's well-publicized opioid crisis. Neonatal abstinence syndrome is the label given to this condition, but neonatal withdrawal syndrome seems more fitting, considering abstinence is something the neonate is unable to achieve in utero. Now let me share with you some things concerning NAS. Within 48 hours after birth, a newborn with NAS will start to experience signs and symptoms from the central nervous system and also suffer from vasomotor and GI issues as well. These symptoms include tremors, stiff or rigid muscle tone, high-pitched or excessive crying, poor sucking reflex, irritability, jitteriness, sweating, tachypnea, and bouts with diarrhea and/or watery stools. In more severe cases, seizures are often seen. The severity of these symptoms greatly depends on a few key factors, such as the mother's most recent use of the drug, her body's metabolizing ability of the drug, placental metabolism of the drug, and the neonate's ability to metabolize and excrete the agents to which it has been exposed. Unfortunately, there are both short and long-term effects that can result from NAS. The short-term effects include the obvious withdrawal symptoms and are usually present in the first 48 to 72 hours of life. The long-term consequences of NAS are the results of delays in the child's physical, mental, and physiological development and often lead to lifelong disabilities. As with many diseases and conditions, early diagnosis and timely interventions are the key to greatly reducing developmental delays in NAS neonates. This can be accomplished by a thorough and accurate gathering of the mother's history to determine the newborn's risk of NAS. If the child is to be found at risk, screening is performed using a standardized scoring system such as the Finnegan Neonatal Abstinence Scoring System, or NASS. There are other approved screening tools, but the NASS is most commonly used. The NASS is performed hourly for the first 24 hours, every 2 hours for the next 24, and every 4 hours thereafter. This schedule helps in identifying withdrawal symptoms and their severity, along with assisting a provider in determining the proper treatment regimen. Lastly, I would like to finish by saying, as the opioid crisis continues to spread, the number of maternal substance abusers will continue to rise, leading to more neonates being exposed to drugs in utero, ultimately resulting in more cases of NAS. Thank you for your time, and you all have a great night. Thank you.